anaesthetic, you're going to feel...
Actually, do you know what I'm going to do? Because she's going to block your view. Claire, you stand where you are.
If anybody feels faint, please say it and leave.
Take a step forward.
Okay? Don't stand in the chair because you'll be the very one who'll feel faint, I think. And then when you hit the floor, we'll have to go mopping up your blood. Okay, so you're going to feel a pinch. Okay, I'm going to insert the needle. You're going to feel a pinch, then you'll feel pressure. Once your toe is numb, my colleague is going to do the surgery. He's going to remove a little bit of nail this side and a little bit of nail that side. Are you happy enough with that?
Yeah.
Then we're going to apply some phenol. This nail should not grow back. There's a chance it might grow back, but I'd be pretty sure that this nail won't grow back, but that's what we're hoping for. You need to explain to your patient, I'm not just going to stick a needle in her and say we're going to do nail surgery. You need to explain to your patients what you're going to do, because some patients might say, I don't want you to remove the nail permanently. Okay, the majority of patients do because it's painful. That's why we're doing the surgery. So I'm going to remove a little bit of nail on the lateral side and some nail on the medial side. Okay, when we're doing the surgery, you'll feel some pressure. So you feel that pressure on your small nail. You'll feel pressure, but you shouldn't feel a sharp pain.
Okay.
Okay.
Yeah.
So at any stage, if you want to let us know if you're feeling pain, okay, during the surgery, let us know. But other than that, you're going to feel a pinch when I give you the anaesthetic. But in the meantime, I want you to lie back. Okay, because I don't want you to faint on me. So lie back, relax. And I'm going to start. Okay, so I'm just checking my syringe. So 2.5 mils there. You comfortable?
Yeah.
Yeah? You want to watch. So when she faints, she wants to watch, okay? So I'm wiping it with an alcohol wipe. Making sure my needle is in place. So there's 2.5 mils, almost 2.5 mils in my syringe, so there's no bubbles, I don't think. So 2.5 mils exactly, alright. So you're going to feel a sharp pinch. I'm just going to rest my hand on your leg, Amy, so you don't give me a kick. So, and the needle is in. Okay, so the needle is in. I'm just going to aspirate. Okay, Amy, so you'll feel some pressure. I'm just going to move the needle slightly actually, just doesn't feel comfortable. I'm going to aspirate again, so every time I move my needle I need to aspirate so that I'm not in a vessel, okay? You okay there, Amy?
Yeah.
Feel pressure?
Yeah.
So 1.2 mils in the top for foot. I'm going to move my needle towards the plantar aspect. I'm making sure to watch for the toe blanch on the other side because I don't want the needle to go right through. You okay there, Amy?
Yeah.
Feel the needle come on the other side, so I just come back slightly. So I didn't feel it actually. I saw it, okay, because I keep my fingers out of the way. I've aspirated and now I'm going to inject. So I can feel a little bit of resistance. Okay, so it's still going in, but I can feel a little. My needle moved slightly on me, so I need to aspirate again. So if your needle moves, you need to aspirate. Safety lock, I'll leave that to one side because I want to know how much anaesthetic I've put in. How was that? Good. Good. I'm going to move over to the other side. Make sure my needle is on. Everybody still okay? Nobody feeling?
That ball's just kind of shaking a little bit.
It's okay. Yeah. Take off my top, so just insert it again like a dart, just on the medial side, and the needle is in. Need to aspirate. Just feeling a little bit of resistance or something, so I just move it slightly. Aspirate again. So Doesn't matter how much you move the needle as long as you aspirate every time. So now I'm going down to the plantar nerve. So I aspirate, don't move my needle, and the rest of the fluid in. You okay there, Amy?
Yeah.
And that's it. That's you done, okay? So my colleague will be here in a second, and he's already here. Now, push that over there somewhere out of the way. We're good to go?
We are indeed, yeah. Let's just get my trolley. Everyone just move out the way a second. Let's get the trolley on. We'll get the trolley on.
So that toe is really full of anaesthetic, okay? Which side do you want it?
That's fine, yeah.
Which side do you want your trolley on? The right?
We're good to go. And you can open the green turn it apart. I think that's anything we're missing. So I'm surgically clean, I'm clinically clean now, okay? So everything that's on here I can touch and handle. There's still minimal touch, but you can still touch everything, alright?
You have paper of your gloss there just on the side, Sean.
And then I drop down to the foot, just wrap the foot for me.
I will.
Okay.
Is that high enough for you, that chair? Do you want it a bit
Go up a
higher?
little bit higher actually if you would.
Stand along the other side, let's move the bed up a little bit higher for me, please.
Naomi, are you okay watching or do you want to lie
Gloss
back?
for me there.
Oh no, actually.
Thank you. Does it go higher?
That
That
is
it?
the highest.
Okay, well, that's as high as we've done it?
No.
Sorry, is there a way to zoom in the camera?
No,
Okay.
it's a vloggy. No, it's not your...
Will we tilt it back a little bit, or do you want it that
No,
angle?
she's fine, it's absolutely fine. Just need some back skin and we're good to go. Sorry, no.
In.
Sorry.
So we're not going to do anything yet, okay? I'm just going to swab the toe down, okay? I'm not going to actually do anything yet. So we're just decontaminating the area, yeah? We're going to bleach the skin. So the last thing we want to do is introduce an infection to the area, okay? So now I can touch it. Okay, that's the whole point because I'm clean. So the foot's clean, I'm clean, the instruments are clean. Alright, they're not sterile anymore because as soon as we open them, they're not sterile anymore. So don't refer to them as that. Okay, I'm just going to use this just to see if the toe's numb. So would you lie back and close your eyes for me? And let me know if you can feel any sharp pain. So remember, you'll be able to feel me moving the toe. So you feel me moving the toe next to it.
Yeah.
When I'm moving this one, you can still feel me moving it, can't you?
Yeah.
What you shouldn't be able to feel is a sharp pain, okay? So if you feel any sharpness, just let me know.
It's a little bit sharp, but nothing.
Okay. What about this side?
No, nothing. A little bit.
You feel me pressing, so you feel pressure.
Yeah.
Once there's no sharp pain, we're good to go. So just
That's a little bit sharp.
a little bit on a scale of 1 to 10.
About 3, 4.
Yeah, okay, we'll wait for another couple of seconds. We're doing a partial, are we? We do a 64. You drop it down, I'll stick it on there, right? While I'm waiting. So just wait for a couple more seconds, Amy, let it go off and we'll try again, okay? That's how these things work, exactly.
One was a little bit dodgy.
Some of it dodgy.
Do you want another one? Is it
No,
not?
it's fine.
It's okay. At the door if you can.
Need to close the door after we've got rid of them. Go on, Fiona, you get stuck in.
What's up there? You're coming, Fiona.
Swear to God, he's going to kill you. Okay, madam, go back, close your eyes again. So you can feel me moving here, can you feel just a bit of pressure? It's a bit weird sensation, isn't it?
I can feel you holding my coat.
Yeah, that's perfect. How's that, everything alright?
Yeah.
Okay, so you can relax, we're going to start, that's fine, you're nice and numb. So we're applying the tourniquet, I'm going to squeeze the medial lateral aspect of this joint. You can snap the toe if you're not careful, because I'm applying most of my body weight on this. And I'm forcing it down. You see how I held the toe? If I'd let it bend, it could cause trouble. Pushing it down as far as you can. That's gone behind where we injected, so you probably feel it quite tight there. Is that okay?
Yeah, that's fine.
So depending on where you inject, this would actually sit behind the injection site. So time, please. Someone keep an eye on the time. Someone go watch on.
Tourniquet on. What time is it, Jennifer?
2:02.
Say 2:02. We'll say 2:02.
2:02.
Tourniquet on,
So
okay?
someone write down 2:02 and we're going by Jennifer's watch.
Okay, so we're doing a bilateral partial. So the first thing I'm going to do, you see how the beddings come away from the toe? That's fine, alright? So I'm going to use my, what's this?
That's fine.
Recognise it? Black file.
Okay.
We have it in most of our packs, don't we? So first of all, what I'm going to do is I'm going to make a mental note about how much nail I'm going to remove. So I'm going to mark it for you today, but I don't normally mark it. Just to give you an idea of my sort of line of sight. So it's all about there. You happy enough, Amy? We go for that. Can you see the little faint line? You need to make a visual mark, because now what I'm going to do is I'm going to use the black file to separate the skin on top of the nail. But you see where the line is? I'm not going past that. Because I want the rest of the nail to survive this, don't I? It's the same the other side. I'm going in and I'm pressing. I'm pushing quite firmly. See, I'm separating it. I can't remember if it's the hypernicum or the eponychium. I get confused. Eponychium. But there you go. You see, I'm in there. If I tried to do that without local anaesthetic, Amy would be kicking me in the head now, wouldn't she? So now the skin's separated in the top. What's the next thing we do? What do you think?
Push back.
How about we separate the nail bed from the nail? Okay, so we're going to use the same black files. So we're not doing anything drastically different. We're just using the same tools in a different way. Introduce it, flat side to the nail, and push.
Very important, flat side to the nail. Okay, students, you need to remember flat side to the nail.
You see that?
Or flat side to the nail bed, should we say. Okay, so the flat side is... Just we automatically do it without thinking about what we do. Okay, so David has the flat
So
side.
see how far it's in? Now it's not so, Amy, is it?
No.
But you have to use a little bit of brute force now. It's an unusual sensation, isn't it? But look, see how far it's gone down? I need to make sure that nail is removed and it's actually separated from the nail bed, otherwise I'm going to cause trauma. So I'm pushing right past down because we're trying to remove right down to here, and you'll see that in a second, okay? So I'm pushing. If you get a really bad ingrown toenail, which is quite bad on this side, I'm making sure that the whole area in the sulcus is clear and we're good to go. Alright, pop it down. Next thing now is weights nippers. So these are very similar to normal nippers, but they've got a fat side and a thin side. Can you see that? Right, so which side do you think I pop underneath the nail? The flat, thin side. Yeah, so it's not the cutting edge, it's the guiding edge. So I hold it like a dart, and I'll do this side first. I'm going to position it and I'm going to push down as far as I can. But when I close the top jaw, I don't want to be pinching the skin. Can you see that? So I'm lining it up with where my line of sight is, and I'm going to hold it down. See how it's not gone onto the skin? It's just on nail. Squeeze. So I'll do the same again this side so you can see this side. So I'm using it like a dart. Forcing it in, but I don't want to go into the skin there. So look, see that? So pinch. See the click? Once and remove. Okay? This is a chuck handle with a beaver blade on it. So this is a wedged blade. So this is a different type of scalpel blade you're used to using, but a scalpel blade nonetheless. It's a different technique, but it's the same instrument, okay? So what I'm going to do now is, can you understand that I've only cut the nail I can see? I now need to cut the nail I can't see, going right back into the nail matrix. So using the line that I've already cut with the thwaites, I'm now pushing in. So I can still see the scalpel, can you see it? And now what I have to do is I push. And it popped. Did you see that? Now the pop is something we talk about. It's not an audio pop. It's actually, you can feel it pop. What that is, it's the nail giving way. It's a little push. Pop. You see it just disappear? The resistance just disappears. So I pull out. Forceps. 18.5 centimetre mosquito nose forceps. The same ones we use for clinic, okay? So I'm going to use them. So remember, they click 3 times. Listen. That's it, locked completely. So you want to wait for the 3 clicks. If I get stung, I'm going to be very unhappy. But I won't be dead. Okay, so what I'm going to do is, we're under time pressure, so this will happen. You need to keep going, alright? So I'm going to rely on someone else to make sure I don't get stung. I'm going to introduce the forceps, into underneath and on the top. So I'm taking hold of the nail that I've just sort of dislodged. Can you see that? And I'm going to click 3 times. I need to push it into the corner and get as much as I can. Listen. 1, 2, 3. I can let go of that now. I wouldn't recommend it, but just for demonstration purposes. I need to take my fingers out. If you're trying to remove it, it's a big movement, okay? What I'm going to do is I'm going to turn a tap. So this is a tap movement, we call it. So it's going to, 2 things are going to happen. I'm going to drop it down and I'm going to twist to the midline of the toe. So watch. Hold the toe steady. So I haven't got my fingers in the holes of the forceps. I drop and I twist. And I pull away. And there's our nail. See how much came out? We're checking here now for the feathered area. See how the nail thins out to nothing at the edge? That shows me that I've got a full piece of nail away and the edge looks quite clear. So you happy enough? Let's do it again. So I'm going to use my thumb and finger in the forceps as usual and stick it in. This one's a bit looser, so I won't let go, but I click 3 times. I'm going to hold it in place this time while I move my hand. Turn to the tap. So I'm going to drop my hand and twist the midline. Now it's a nice chunk, isn't it? Okay, so I'm going to speed up a bit now because we've been dilly-dallying a bit. What I'm going to do now is keep my forceps in my hand and I'm going to use my blade for a different purpose. Can you see this excess skin? So it's a wedge blade, so the same technique we always use, but I'm just going to take away this. You can put a 15 blade on, but we're trying to do it within 5 to 10 minutes, so we need to be a bit quicker.
So it's important that you take away this excess skin, okay, when the toe is numb.
Yeah.
It's going to be there the next day when the toe is not numb if you don't take it away.
You take your old friend Black's file again, now we're checking. So I'm going into the areas that I've just performed surgery on, right down. See how far, where my thumb is? That's where my Black's file is sitting now, that's into the matrix. I need to make sure that's clear. Okay, so there's no nail down there, it's nice and clear. You can feel a click. Again, it's hard to explain, but you'll feel it. It's nice and clear, and you can feel me moving, can you?
No.
Sometimes the patient can say, I can feel it quick, okay? We'll make sure it's clear. If there's any hypergranulation, any issues, that's when we're removing it. So now what we're going to do is, alcohol please, sorry. I'm going to wrap the toe, oh wait, so I'm going to take one of the dry sterile gauzes and I'm going to douse it in alcohol. This is sort of optional in literature, but we tend to do it because we use the tourniquet, so you can get what's called a ring burn. So what happens is if the phenol drips and it gets to the tourniquet, it can run all the way around the toe and it can cause a burn. So we just make sure that doesn't happen. Now to double check that, to make sure it doesn't happen, I want you to bend your knee for me please and put your foot flat on the bed. So now we're going to use gravity to hold it in place, okay? So I'm going to take a 1 ml syringe, but I'm not going to stick it in anyone, alright? This is going to have phenol in it, so we have to be careful.
That's before June 15.
June 15, thank you very much. So we're checking the phenols and date. How long's the tourniquet been on for, please?
8 minutes.
Okay, so we're well within time. We're not going to cause any long-term damage or ischemia to the toe, but we need to check that. We have to be in time, okay? So what I'm doing is I'm going to hold the toe. I don't want to touch the bed because I'm still clean, yeah? But what I'm going to do is I'm going to try and introduce this into the corner and pop a little bit of liquid in. So it's a tiny little amount. You see how little I'm using? I can do both sides at once. Let's try the other hand, Dave. Tiny bit, you see it? Take my Black's file. because it's such a small area, there's little air pockets. Watch the disappear. Watch the phenol goes in. There's usually an air pocket in small spaces. So I work it in, and then it just sits there. So there's a thing called scarification that we don't do, but we might start doing again by next year. Whereas the technique that you use the blacks file, and you actually keep doing that. Okay, we're sort of debating about whether to reintroduce it because we are getting some regrowths. We don't know if that's the reason or the change of chemical, alright? So we're going to time that, so you got to watch on. Give me a minute. So 3 1 minutes, is that what we do here?
A minute and a half now, we've upped it to.
Oh, have we? 3 1.5?
3 1.5
Oh
minutes.
Jesus, this is the boring bit. So it's important now. You got to still. You can't. This is where you're going to make mistakes and start scratching your head and you have to maintain your field. Okay. So while you're waiting for this to happen, your assistant will be waiting, sort of thinking, what am I going to have for my tea? Blah blah. Right. So what we can start doing is we're going to address this. So can I get a Mepital, 2 Calcistat, 2 Malalin, and the tube course 01 on the applicator I'll give you now. All right. So you need to give a few instructions. I'm not being disrespectful to Linda.
Mepital. Okay, Mepital. So make sure if you don't know what your colleagues asked you for, ask them again.
Mepital. Yeah. Thank you.
What else
So
did you say? Calcistat.
2 Calcistat, please. So I'm expecting the area to bleed. If it doesn't, I've wasted 2 Calcistat, but we put it on anyway.
Calcistat.
All right, the Mepital's a barrier dressing, so it makes sure the Calcistat doesn't stick to the wound. But if the wound does bleed, the Calcistat chemostatic action can get through the Mepital because it's a grid. All right, Mepital's very expensive.
Good job, Calcistat's not.
Yeah, exactly, Calcistat's not. All right. But I'm wearing goggles because phenol is quite caustic and it's quite nasty, so you don't want that getting in your eye. Okay, you have to treat phenol with a lot of respect. All right, just be very careful with it.
Just another thing, see when David masked the toe, he put the alcohol on it and he put it around the base of the toe. He didn't touch the nail. Some of the students today were almost putting the alcohol on the nail before they went to put on the phenol, so make sure you don't.
It's a minute and a half. So what I'm going to do is I'm not going to wash out with alcohol now because I'm going to reapply the drug. Well, the medical device as phenol is, it's not a drug. So what I'm going to do is wrap my blacks file. So you can see how much we're using the blacks file. It's important, isn't it? So what I'm doing is clearing that liquid away from the area because there's no point using alcohol because the alcohol will just disperse it and stop it working. Right, good to go again. So 1.5 minutes again please, chef. So we're popping it in, in we go. So 1.5 minutes from now please. So very gentle with the, see I'm tapping it, I'm not squirting it. Again, just make sure that it's in there where it needs to be. So, in theory, the phenol doesn't need to be anywhere near here in these sulci, does it? If you're talking about what phenol does, it denatures the cells at the matrix. So if we could find a way that we'd only apply it underneath the skin, we would. But it's just easy to do this. Because what we're doing is actually causing a chemical burn for the client, aren't we? But we're doing it knowingly. You okay, Amy?
Yeah. If that was a total nail avulsion, like what way would you apply the phenol then?
Exactly the same, it's just with this nail plate wouldn't be here, so I'd be applying a little bit more. So I'd be using the same technique, but just going in all the way and then round the front.
Okay.
It's exactly the same. Good question. Totals are a lot easier than partials. Totals take 4 minutes if you do it properly. Until I met Linda, all I did was totals. She sort of convinced me that some people in the world like toenails and like to keep them. Because it's quicker and it's easier and, you know, way of the world, isn't it? 1.5 minutes. So once again, we're going to take a sterile gauze. I'm going to do what I just did before. So pop it in. So we're not washing it again. After the last time, we're going to use alcohol to wash it. Okay. Pop it in. You okay? So we'll go for one more. So you start timing now. Wax file last time. So it's very ritualistic, very standard, okay? There's nothing changes. Patients change, the nails presentation change, but the procedure shouldn't deviate too much. So just relax your toe please, you're just flexing, yeah, there you go. I know you want to see, but it's going to run out your toe in a minute.
What length would you like your tube gauze?
whatever's out of the box there is perfect. Yeah, you take it. Yeah. So we're nearly finished, so we're telling our patient, normally we'd be chatting away to the patient, but it's a bit weird with all of you stood here.
So, Amy, when you get home, you need to take the painkillers you'd normally take for a toothache or any kind of a pain, headache, whatever you'd normally take. We recommend that you don't take aspirin. So what would you normally take for a headache or a toothache?
Panadol.
Panadol, so you can take a couple of Panadol. Take as many as you're allowed safely to take in 24 hours. You might need to take a few today, a few tomorrow, and we'll see you back on Thursday for a redressing. Okay. If you have any issues, you can give us a shout up until 4:30. We'll be here till 4:30 today. If you have any problems after that, you need to go to your GP. And if your GP is out of hours, you need to go to A&E. If you have anything serious, you have an awful lot of pain and you're really worried about this toe after the surgery, then you go to either your GP or A&E. I don't imagine you'll have any problems. Okay, so what I want you to do in the next 48 hours, keep this toe dry, keep it clean. So don't take off the dressing that we put on today, leave it in place. If you're having a shower, keep your foot dry. So you can either wear a glove in the shower, whatever you need to do, or just not have a shower until you come back the next day. So make sure to keep it dry. If it's a thing that it bleeds right through and the dressing looks terrible, we're going to give you a couple of dressings today to take away with you. So if you want to put a dressing on top of it, then you can do that.
Okay.
Okay, so we've just dry wiped the phenol away again, just for safety's sake, so we're not splashing liquid everywhere, so it's nice and dry again. I'm taking alcohol out of a galley pot. Can you see that? You can tip some on if you like. I'm going to squeeze it, I'm going to wash it away. I'm actually going to just, see I'm actually pressing the toe. The idea is we're dispersing the phenol. We don't dilute it with alcohol. It doesn't dilute with alcohol. So we're just trying to move out of the area. It's self-limiting. It'll be deactivated in a couple of minutes anyway. But I'm happy now. 1.5 minutes, 3 times applied is plenty for this toe. Okay, straighten your leg for me. Okay, I need to get the tourniquet off. Tourniquet time, please. Tourniquet off. So my thumb in. You see where I've got my thumb? There's a pair of scissors in the kit. I pull out with it the scissors, so there's a blunt side and a sharp side, so make sure I'm not going to cut my patient, the same as always. I held on to the thing, the tourniquet shouldn't be hitting the roof, okay? I'll move it with my fingers. Okay, before we do anything else, before we get drastic with dressings, we're going to wait for...
So tourniquet off. Somebody timed that?
Someone timed it, didn't they?
Jennifer?
Yep. So it's on for
Take my
15
goggles
minutes.
off, will you?
Perfect.
Sorry that. Okay, thank you. So the phenol's gone and the goggles are getting them away, so I'm stopping now. So I'm going to just pop this over. So I'm waiting to look for, what am I looking for? Blood to come back. Revascularization of the area, perfusion, whatever you want to call it. So we're waiting for the toe to go red again, for this blanchiness to go away. And hopefully if we're lucky we might strike oil, there might be a little bit of blood. Okay, so we're just going to wait, we're going to massage this area.